Well, a warm welcome to this talk. It's Sunday, the 5th of May. Now, I believe that the truth about COVID vaccines is starting to come out. I wasn't sure whether it would or not for quite a long time, whether this would be suppressed or whether it would come out into the public domain, as it were, or the widespread public domain. And what I want to look at today is a very encouraging article from the New York Times. This was published 2 days ago. This is the article here. Thousands believe COVID vaccines harm them. Is anyone listening? Now, this article is not sort of an interrogative, analytical article that you and I might like, but what it does do is it admits overtly that there are serious side effects in some people with these vaccines, but it still does take the overall tenor that the vaccines were beneficial altogether, which we could discuss and we have discussed. But it's a move in the right direction. Now, why I think this is so important is this. Now, if we look at this here, this is called the Overton Window. Now, what was unthinkable, completely unthinkable, becomes a radical idea. Then it can become acceptable. Then it can be sensible. Then it can be popular. Then it can be policy. And of course, that can come from either direction. So the window has changed. The window slides up and down on this thing here, as I understand it. And so I think we're moved now to, I would say, when probably at the acceptable level now, because it's in some aspects of the mainstream media, or some aspects of thinking are in the mainstream media. Now, I don't think I've gone intellectual. I only got that from Claire Craig's Twitter account, so that's how I knew about that. But I think it's a very good model. It shows that things are starting to come out now much more into the public domain. Now, let's look at some of the detail here. This is more or less straight from the article, published on the 3rd of May 2024. Case study it starts off with. I've decided not to use names on this. The names are in the article. The article, you can get it. I think you might have to register, but you don't have to pay for it. You can actually get the article, which is also good because New York Times articles are often paywalled. So that's another very encouraging sign that this is coming into the more public spectre of consideration. So I'm not going to use the names, but 37-year-old woman, fit and well, within minutes of getting the Johnson & Johnson COVID vaccine, felt pain racing from her left arm up to her ear and down to her fingertips. So pain straight away, within minutes. And that's got implications as well. Was there an inadvertent intravascular administration or a greater level of intravascular administration, you might think, but we don't know that. Felt pain racing down from her left arm to her ear and down to her fingertips. Horrible. Within days, she was unbearably sensitive to light and struggled to remember simple facts. And it's interesting that it actually starts off with this. So this is the New York Times. So it's quite a powerful starting paragraph, really, I thought. Now, 3 years later, diagnosed with brain damage, cannot work, drive or stand for long periods of time. She says, devastation of what this has done to my life and how much I've lost. And one of many accounts, of course, and we have interviewed so many people. Kyle Warner, that we interviewed just a couple of days ago on this channel. I'll put a link to the video. Who's now campaigning for vaccine damage awareness. As of April 2024, there was over 13,000 vaccine injury compensation claims filed with the federal government. Now, what I've done here is I've actually taken the data that is published, government data here from the United States, and they are saying that there's 13,116 claims, but what is telling on this is compensated claims 12. So in the United States, 12 people have been compensated for vaccine damage. 12 out of the entire country. Quite incredible. Of the cases that have been put forward, 19% have been reviewed, 47% deemed ineligible for compensation so far. 12 claims paid out, an average of $3,600. This has to change because firstly, these people deserve recognition. And secondly, we have to restore trust in our medical systems. Now, those medical systems have now got to prove themselves. You know, the journal system, the pharmaceutical system, they've got to prove themselves worthy of trust. And that's quite a big ask, some might think. But we have to have this transparency because at the moment we have this lack of trust and it's doing no one any good whatsoever. And to hide these things is not fostering trust and understanding and the reality of the situation. This has to be remedied. Immunologist, vaccine expert, University of Yale University. People who say they have post-vaccine injuries just completely ignored, dismissed and gaslighted, which has happened so often, very often, especially in the early stages. People simply told this was an anxiety-related problem. Janet Woodcock, recently retired director of the FDA. It's quite interesting, actually. The people that are free to talk are often retired, and we could give a few examples, or nearing retirement, or feel free to talk, which again is a tragic situation. We have to have freedom of medical scientific expression. Otherwise, we're going to return to the Dark Ages. There's so many implications to this. They just go on and on. Anyway, Janet Woodcock. Some recipients got uncommon but serious life-changing reactions beyond those described by federal agencies. So, okay. Now, interesting, Janet Woodcock's not saying rare here. She's gone down to, is uncommon a weaker word than rare? I would have thought so. Then she says, I feel bad for those people. I believe their suffering should be acknowledged. This is key. The suffering needs to be acknowledged, and they have real problems and they should be taken seriously. And to her credit, she's saying, I'm disappointed in myself. Many of us, of course, are disappointed in ourselves, but it's good for people to admit that. I'm disappointed in myself. I'm sure many of you are. But for someone who's been in a senior position to acknowledge that, I would say it's encouraging. It's a step towards freedom of speech and expression and the reality of the situation. Again, Janet Woodcock again. I did a lot of things I feel very good about. Fair enough. But this is one of the few things I just feel I didn't bring it home. The article then comments on disparities in disparate US healthcare systems. So what it does, the article does say that US healthcare systems, you might go to a pharmacy for a vaccine and then your doctor might not know about it if you've got a doctor, and it's all compartmentalized. So collecting data in the United States is a problem. In the United Kingdom, it's not. The problem here is my government has released data on vaccine adverse reactions and people that are no longer with us to the pharmaceutical industry, but has not released it to the public domain for interrogation by our scientists, epidemiologists and statisticians. So it's a different situation. In America, the data is difficult to collect. In the UK, we are being secretive about it. Two different situations, I think. Article then, disparities, the disparate nature, sort of all divided. No central responsibility of vaccine recipients in the States. Government Compensation Fund officially recognised a few side effects for COVID vaccines. And vaccine supporters, including federal officials, worry that even a whisper of possible side effects leads to misinformation, spread by a vitriolic anti-vaccine movement. Okay, there is an anti-vaccine movement. There's also a movement that I would like to think I'm but I'm a very small part of, people that are simply looking for the truth. We want to follow the evidence. That's all we want to do. So there's been this idea that government officials haven't dared whisper anything about any vaccine adverse reaction because this group of ogres, these hideous people that would weaponize this against this oh so good vaccination program. I'll let you decide where you lie on that continuum. I'm not so sure the vaccine program is that good, but you'll have your own opinions on that. Now, patients who believe they experienced serious side effects say they have received little support or acknowledgement, which is true. That has to change. Now, New York Times then gives some examples, and again, it gives the names. I'm just decided not to use the names. SB, 54-year-old male man, nurse practitioner, New York City. Ever since his first COVID shot, merely standing up sent his heart racing, postural orthostatic tachycardic syndrome. This is this POTS syndrome that has been a common presentation around the world. When people stand up or exert themselves, the heart rate goes very, very, very high, this tachycardic syndrome. And when the heart's beating very quickly, it's often beating inefficiently. as well, unless it's a physiological situation. This is a pathological situation. And of course, that can make people go dizzy, faint, fall over. Apart from the horrible feeling, very disconcerting to feel things going wrong with your heart. I mean, it's a horrible thing to happen. Stinging pain in the eyes, mouth, genitals, which has abated, and tinnitus, which has not. Atrial fibrillation, I guessed from the picture that was in the newspaper. Also, I can't get the government to help me. I'm told I'm not real. I'm told I'm rare. I'm told I'm coincidence. And this is why the media is so important, because people can realise that they are not alone. And that's one of the reasons we've been interviewing people with vaccine injury who've nobly come forward. And we've realised that there are many people with very similar symptoms all around the world. People are not alone and should not be made to think they're some sort of freak. RF, 49-year-old physical therapist woman, Seattle, Bell's palsy, the facial paralysis, dramatic facial rash, shingles, reported to the federal database twice, expected someone to come. I thought someone for sure would reach out, but no one ever did. So no interest at all from the authorities. New York Times then talks about interviews with 30 people. And we can divide these symptoms, and this is consistent with what we're seeing around the world. Some are neurological primarily, some autoimmune primarily, and some cardiovascular primarily, although some people have mixtures of those, unfortunately. All these people of the 30 said they'd been turned away by physicians, told their symptoms were psychosomatic. It's appalling. Psycho, of course, means mind, the mind affecting the body, or labelled as anti-vax by family and friends. We must stop stereotyping people and listen to people as individuals. We've said this a million times on this channel. Healthcare has to be individualised. We assess, plan, implement and evaluate on the individual, not on a population. BC, doctor, man. Tinnitus, racing heart, lasted about a week after each shot. Yeah, this guy's there's another one, GP, also a doctor, also a man. Loud whooshing sounds in his ears accompanied every moment since his first shot. How appalling must that be? This constant noise in the ears, it must drive you completely crazy. The first thing you're aware of when you wake up in the morning is this whooshing sound in your ears. Appalling situation. How can you work or function and not go completely mad with something like that? We have to listen to these people. Entreaties to colleagues at Centres for Disease Control and Prevention to explore this phenomena, tinnitus, had led nowhere. If they've done studies, GP says, if they've done studies, these should be published. Of course, everything should be published, put into the public domain for scientific peer review. This is how science progresses. Thesis is presented, antithesis can be argued, synthesis emerges, that becomes the next thesis. This is how we develop. We have a bit of a ding-dong down the pub over a few ideas. We discuss it in academic papers. This is how science develops, but it's not being allowed. It's being emasculated. Has to change. CDC recognises. Agency documents only 4 serious. This is incredible. I didn't know this. Only 4 serious adverse events from the vaccine. So Johnson & Johnson, Guillain-Barré, the progressive, the paralysis often starts from the feet, works up, can affect the respiratory muscles, caused by an inflammatory polyneuritis, is recognised, and the blood clotting that we've talked about many times, also recognised. mRNA vaccines, heart inflammation or myocarditis. So the heart inflammation and anaphylaxis. So according to the CDC, there's only 2 adverse reactions from Johnson & Johnson, or 2 serious ones, Guillain-Barré and blood clotting. From the mRNA vaccines, the only thing you've got to worry about that's serious is heart inflammation or anaphylaxis. I mean, dear me, this is the Centers for Disease Control in the United States of America. It really is quite incredible. Anyway, nearly finished. Director CDC's National Centre for Immunisation and Respiratory Diseases, this doctor. Agency's systems for monitoring vaccine safety are pretty close to ideal. Do you think they're pretty close to ideal? Let's just check that's what he actually said. Yep, that's what it said. Pretty close to ideal. God, dear me. I thought there might be an issue there for a minute. What a relief. The systems are pretty close to ideal. And this is someone who's a director. I mean, okay. CD said there were no confirmed related to myocarditis, but in fact there have been several accounts of reported post-vaccination. I've left the hyperlinks in. And a pity we're not even completely free to discuss it now, that we have to use modalities of communication to communicate deeper truths. It's unfortunate, inconvenient. Anyway, there we are. Are we moving? Looks like we probably are. And as was said, I think we're at the acceptable level. Next, it will become sensible and popular and hopefully become policy. Interesting. I did think that this could go either way, because there's certain things, even now I'm not sure what I'm allowed to mention, that have been suppressed during this, during the last few years. I wasn't sure if this would be one or not, but I think the problem is so ubiquitous, so obvious around the world. That this one's probably going to come out as a massive, massive, massive issue. Things are moving. And if we move towards greater truth and transparency and openness, I think that's a good thing. Let me know what you think, and thank you for watching.